The first part to start with, after like sort of assessing our baseline, is like, what is the patient's goal? Because that tells you a lot about what is the most bothersome to them. Like
Mm,
I always ask people, tell me what are your top three goals related to your health, because that tells me what's bothering you the most. And that tell like whatever's bothering you the most is probably the most severe thing going on.
mhm.
Not always. Sometimes things are going on that people don't recognize, but it just gives me a sense of like, okay, you're really feeling like this needs to change. So this is somewhere we need to dig in. So I like to always start with having what the patient's goals are because it gives me sort of a direction of where my concerns might need to be. But for every patient, we're doing a full set of vitals. And for patients, particularly with nutrition concerns, I'm usually doing orthostatic vitals. So we're going to be doing, heart rate and blood pressure, both lying down and then standing. And then we're going to be doing height and weight. I do check height and weight on all of my patients,
Yep.
but this is just baseline measurement to know kind of where we're starting from. And then we're going to do head to toe physical exam. And particularly in patients with, there's a concern for disordered eating or malnutrition, I'm going to be looking for any signs of malnutrition. And so that can look like decreased circulation, particularly in the fingers and toes, where they're feeling cold or they're not, rebounding. If you kind of press gently on the end of your finger, it kind of turns white and it should rebound pink pretty quickly.
Mhm.
And if that's not happening, that's an indication that your circulation's off. We're going to be listening to heart and lungs, make sure we're not hearing any abnormal heart sounds that can sometimes be heard in particularly more severe malnutrition. We're going to be assessing the abdomen, make sure the liver is not enlarged, see if we're feeling like a lot of trapped stool, doing that sort of assessment. Then we're going to be looking for swelling in the legs or feet that we can sometimes see with malnutrition or with other metabolic health conditions. So it's really a head to toe exam. A
Yep.
big one that I always do is looking in the mouth and looking at the throat to assess the airway, because
Oh,
a lot of people who struggle with metabolic health problems, which are people who are commonly going to fall into disordered eating patterns, have sleep apnea. And sleep apnea is super underdiagnosed. It's very highly correlated with PCOS. PCOS is a risk factor for developing disordered eating just because of some of the metabolic outcomes that has for their body, and then
right.
also their general approach is lose weight. So, of course, if you tell someone to lose weight, they're going to fall into, some diet patterns that may or may not be beneficial. Of course, me looking in your mouth doesn't tell me if you have sleep apnea.
Sure. Yeah.
But I can kind of look and see like, oh, that airway looks a little small. And then it kind of prompts me to ask some more questions. Of course, I'm asking about sleep anyway at the beginning, but sometimes people will say everything's fine. And then when I look
Right.
at the airway and I'm like, are you sure?